And now the news. The historic launch of the long-awaited National Health Insurance Registration process took place on Tuesday, September 1st, at the Social Security Building in Road Town, where government ministers and officials gathered for the launch ceremony. The NHI is part of the Virgin Islands government's health reform program. Since 2005, successive VIP and NDP administrations have pursued the implementation of NHI, which offers all BVI residents access to health care services for a lifetime.
Universal health coverage involves equal access to needed health care for all people, wherever they live and work, in the formal or informal economy, the poor or the wealthy, the male or female, the young or old, and provide health insurance coverage to the entire population, regardless of age, gender, medical condition, employment, or other status. Every resident will have access to our modern facilities and services, whether in the public or private sector, without having to choose between buying groceries and paying for their visit to the doctor. With NHI, they will be able to do both and not have to gamble with their health.
According to Deputy Premier Dr. Kedrick Pickering, the National Health Insurance Plan will in many ways be like money in the bank to finance the cost of health care for residents both locally and overseas. A medical doctor by profession, Dr. Pickering says NHI is a safety net for persons to access health care.
We have persons among us who live from paycheck to paycheck. They can't afford private insurance, but if they get sick and they come to the hospital, they've got to be taken care of. Who pays the bill? The government has to pay the bill. The system now ensures that that person themselves can help take care of their needs, and all of us bear the burden. The bills are not going to disappear. Minister Skelton has to pull out his hairs all the time when people have to be transferred overseas and then the bill come back to you. I didn't mean that literally, did I? When the bill comes back and says that the individual has accumulated a bill of $150,000 in some hospital in Florida or Puerto Rico, the money has got to come from somewhere. But the system that we are creating is going to ensure that there will be money to take care of those needs.
A Minister for Health and Social Development, Ronnie Skelton, also lamented the burden for access to health care, adding that the BVI Health Services Authority has some $24 million in outstanding fees.
I experienced firsthand the suffering of so many families year after year that could not raise the money to pay for their much-needed treatment and care. Several persons were struck with illnesses or injuries that caused them to use their entire life savings or sell their land and or other hard-earned assets to pay for the health care they needed to save their lives, the lives of their children or their family. In some instances, private insurance denied the claims, or the insurance, as Marlene just mentioned, did not work or it ran out. And the government will assist by providing financial guarantees to healthcare institutions here at home and overseas in order to protect our people from being denied care or from impending financial disaster. The BVI Health Services Authority has recorded over $24 million in outstanding obligations.
Drawing attention to the increased number of BVI residents affected by non-communicable diseases once again, Premier Dr. Orlando Smith welcomed the launch of the NHI, adding that he has seen firsthand cases where residents have been unable to pay for health care services.
As a government, we were heavily subsidizing health care, and particularly hospital care. Something had to be done. But we needed a great deal more than we were able to provide at that time. As a physician and now your premier, I could not sit idly by and not pay attention to these myriad challenges and uncertainty that many of our people faced, especially those without insurance. Many countries around the world have moved in this direction. The United States, United Kingdom, Sweden, France, Canada. And the Virgin Islands will join a number of Caribbean islands such as Bermuda, Cayman Islands, Turks and Caicos Islands, as well as Antigua and others, who all use some form of national health insurance as a principal source of health financing.
Also addressing the launch of the NHI, Professor Emeritus at the University of the West Indies Health Economics Unit, Dr. Carl Theodore, spoke of a World Health Organization's mandate for all countries to introduce universal health coverage systems. Dr. Theodore said of the 200 countries in the world, there are 120 countries that have already implemented or have started the process to implement national health insurance, and he believes that that number will increase to 150 in the next 2 years. Noting that management is one of the challenges for having an effective NHI system, Professor Theodore says the BVI Social Security Board has proven that it can handle the management of such a system.
The NHI is also set up in a way so that the cost of healthcare, which everybody is worried about, which keeps going up and up, the NHI is set up in such a way that those costs could be monitored and controlled. Now, when you set up a system like that, what you're saying is that you are taking a step to improve the quality of the health system you have in the country, and you're taking a step to improve the quality of life in this country. Now, these are objectives that are major objectives. There is a challenge, though, that I think I want to leave you with. There's a challenge that we have with it. The big challenge with the NHI always is management. Let me tell you why. You see, the NHI is really, it's, as I said, it is a pool. There is an inflow to the pool, and there's an outflow from the pool. So somebody has to make sure, that the inflows and outflows are operating in a way that the pool does not run dry. Somebody has to make sure that that's happening. And that is not an easy thing to do. But here is where the BVI can be comfortable, because the agency in charge of the NHI, your Social Security Board, has been managing such a pool for the last 35 years. It's the same kind of pool. Right?
NHI would be administered from within the Social Security Board, which now holds $543 million in its reserves.